was about 6 or 7. My grandpa was diagnosed with pancreatic cancer. He ended up being on hospice care, and my parents bought me one of those little bags with the plastic thermometers and stethoscopes. And I remember going over to my grandma's house and listening to his heart and taking his temperature and all that stuff. And I remember he looked at me and he said, "Oh my gosh, I feel so much better. Thank you." And I just remember that surge of energy and power of, wow, I helped somebody. And I made someone feel better just by showing attention. And so nursing was a perfect fit for me.
I've been a nurse for 12 years, ICU for 8 years, and I've been a flight nurse for 7 years. Flight nursing is absolutely the coolest job in the world. I knew I wanted to do it before I went into nursing school. You come in the morning, you never know what you're going to see, or you never know where you're going to be. Always a part of me is in the back of my mind considered, what if these patients took better care of themselves and had better primary care? And I started looking at master's programs, the different options out there, when I found out that A&M was working on a nurse practitioner program, and I knew that I didn't want to go anywhere else.
If a student asked me why Texas A&M College of Nursing, I would tell them 3 things. First, we have outstanding faculty who are going to provide the best education they possibly can with that student. Secondly, we have a very high NCLEX pass rate, not only very high in the state, but it's very high in the nation. We're above the average in both. And thirdly, we have a clinical learning resource center that is stellar. We not only have high fidelity mannequins, but we use a lot of standardized patients. These are real life people who are taught how to behave as a patient would.
The master's program's just taken all the nursing care I've learned over the years to the next level. It's improved my assessment skills, my knowledge of pharmacology, disease processes, pathophysiology. It's taught me a different way to look at the patient.
When I first came to the college, one of the things I did was interview every faculty and staff. And so I asked them a couple of questions. One of them was, what is an Aggie nurse? What makes an Aggie nurse different? And in that process, I began to learn of the importance of the Aggie core values. Values such as integrity and selfless service and excellence, and how those align with the values of the nursing profession. Because those values are integrated so much into every initiative, every course, every program that we plan, those nursing values are magnified so that people are really able to tell the difference in a nurse that graduates from Texas A&M College of Nursing versus another program. They are excellent leaders. They're loyal. They are committed to selfless service, not only to an individual patient, but to the communities that they live in. And so it really does result in an outstanding, different nurse.
Growing up, my dad always told me that there were 3 kinds of people he never tolerated in his house: a liar, a thief, and a cheat. I just always grew up with those morals, and then I came and toured A&M, and they had the Aggie honor code of an Aggie never lies, cheats, or steals, or tolerates those who do, and I knew I had been raised to be an Aggie without even knowing it. It just became a perfect fit for me.